Hello and welcome to part 2 of lumbar spine anatomy. In part 2, we're going to finish up with the sacrum and then begin coccyx. So before we jump into coccyx, I wanted to show you this posterior view of an actual sacrum. So you can see A is pointing to the auricular surfaces on both sides here, and remember that is the surface that articulates with the ilium to form the SI joint. And do you remember the angle of the SI joint in the body? Yes, it's 30 degrees. B are pointing to the superior articular processes, and they, remember, articulate with the inferior articular processes of L5 to form the zygapophyseal joints. C is pointing to the posterior sacral foramina, and of course there are 4 on each side, and they correspond to the anterior sacral foramina. Remember, blood vessels and nerves pass through those foramina. D is pointing to the sacral horns, which, remember, are the remnants of inferior articular processes. And E is the remnants of the sacral canal, which you can see here. Part of the bone is deteriorated here, but this is the sacral canal, which again is the end of that vertebral canal or column. Okay, well, let's move on to the coccyx. Just a few parts I want you to be familiar with. The most distal portion of the vertebral column, as we know, is called the coccyx. And this picture shows the anterior surface of the coccyx, or the tailbone, as many people call it. This portion of the vertebral column has greatly regressed in humans, and little resemblance to actual vertebrae remain. There are 3 to 5 coccygeal segments. The average person has 4, and they fused in the adult skeleton to form a single coccyx, which is what we see here. So you can see formally different segments, and then in the adult, of course, they fuse. The most superior segment is the largest and the broadest of the 4 sections, and even has 2 lateral projections that are small transverse processes. The distal tip of the coccyx is called the apex. Remember, that's similar to the sacrum. And the broader superior portion is called the base. And again, that reminds me a lot of the patella. Here is a posterior view of an actual coccyx, and you can see that occasionally the second segment does not fuse solidly with the larger first segment, but the coccyx is usually one small and rather insignificant end of the vertebral column. You can also see here that the coccyx is only a little bit larger than a postage stamp. Kind of cool. All right, let's take a look at this lateral sacrum and coccyx x-ray. You can see that the sacrum appears much larger than the small coccyx, and notice how the sacrum is angled posteriorly, and remember that's why it needs a cephalic tube angle when you're doing an AP. The angle of the sacrum posteriorly is generally greater in women than in men, and that's probably related to the need for more space in the birth canal. Ordinarily, the coccyx curves anteriorly, which you can see here, kind of curving anteriorly, so that the apex points towards the pubic symphysis. This forward curvature is often more pronounced in men and less pronounced with less curvature in women. The coccyx projects into the birth canal in women, and if it's too far forward, of course, it can impede with the birthing process. The most common injury associated with the coccyx results from a direct blow to the lower vertebral column when a person is in a sitting position. And this type of injury results typically from falling backward with a forceful sitting action. So if you kind of fell back onto your butt, you could injure your coccyx. Also of note is that because of the shape of the female pelvis and the more vertical orientation of the coccyx in a female, the female patient is more likely to experience a fracture of the coccyx than a male. All right, so I want you to pause your slide here and identify the anatomy in both the superior view and the lateral view. The answers are in the notes of this PowerPoint, or you can find them in your textbook. Once you're finished with this slide, you can move on and identify the anatomy in the AP lumbar spine, the lateral lumbar spine, and then another AP. Okay, good luck. Okay, let's talk about Scotty dogs. So as you know, when we oblate any bone, the specific parts of that bone can be difficult to recognize. And a vertebrae, of course, is no exception. However, we can use this visual aid called a Scotty dog to help us determine if we're correctly positioned in that 45-degree oblique. A good 45-degree oblique projects the various structures of the vertebrae in such a way that this Scotty dog, or Scottish Terrier, seems to appear within the vertebral column. So notice, let's just review, the neck of the Scotty dog is 1 pars interarticularis. Remember, that's part of the lamina on a lumbar vertebrae. The ear of the Scotty dog is 1 superior articular process. The eye is formed by the pedicle. The transverse process, or 1 transverse process rather, forms the nose. And the front legs are formed by 1 inferior articular process. Each of the 5 lumbar vertebrae should assume the similar Scotty dog appearance, with the zygapophyseal joints visualized. Remember, the front leg of one dog meeting the ear of the dog below is what forms that Z joint. Remember, upper lumbar vertebrae will require more obliquity, lower lumbar vertebrae will require less obliquity, but to survey the general area, we simply do 45-degree obliques. Okay, so as you know from lab, positioning of oblique projections requires a good understanding of the anatomy of the vertebrae and the zygapophyseal joints. And it's important to know how much to rotate the patient and which Z joint you're seeing. So looking at these diagrams, you can see that the downside Z joints are visualized on posterior oblique positions. So we're looking at the diagram on the left. The downside zygapophyseal joints are not visible on a skeleton or a model because they're under the bodies of the vertebrae and you can't see them. On the left, assume we are looking from the bottom up. So we're looking from the legs up to the head. And this patient is in an RPO. So their right side is down, their left side is elevated. Therefore, the right Z joint is parallel to the image receptor. And you can see that here. So the right Z joint is open, the left Z joint is not. And again, you can't see that relationship because it's underneath the vertebrae. It's only once you look at the X-ray that you can see that Z joint visualized. Anterior obliques, which we see here on the right, visualize the upside Z joints. Again, assume we are looking from the bottom up. So we're looking from the feet towards the head. And this patient is in an RAO. An RAO visualizes the upside or the left Z joint parallel to the image receptor. And you can see that here. The right side of the body is down, the left side of the body is up. This Z joint is open, this one is not. Okay? Open or parallel to the central ray. Remember, as I said in the last slide, the degree of rotation depends on which area you're looking at. We use a 45-degree oblique for a general survey of the lumbar region, but if you're looking at L1 or L2, you'd maybe want to use 50 degrees. Remember, upper lumbar vertebrae more closely resemble thoracic vertebrae, which need 70 degrees of obliquity to visualize those Z joints. If the area of interest is in the lower L spine, rotation should be decreased to about 30 degrees. Think of the lower lumbar vertebrae more closely resembling the sacrum and the SI joints, which are performed at a 30-degree oblique. Okay, so hopefully this slide helped you to visualize which Z joints are open in which position. Let's wrap up this lecture by talking about some topographic landmarks. And those topographic means landmarks that can help you with positioning and landmarks that are generally palpable. Okay, so A is pubic symphysis. Pubic symphysis is, again, not something we typically palpate. It is found at the same level as the greater trochanter. It's not usually required on an L-spine radiograph, so not really necessary for us to use pubic symphysis while positioning lumbar spines. B, though, the ASIS, I'd like you to remember that ASIS is found at the same level as the first and second sacral segment. Again, not typically used to help us center for the L-spine, but certainly ASIS could help you find crest. Crest is found at the L4, L5 vertebral level. Bontrager encourages us to center at crest. Remember, I usually center about 2 fingers above crest, so I'm closer to L3. D is the lower costal margin, which is found at the L2, L3 vertebral level, and lower costal margin really just means the bottom of the rib cage. And then E is xiphoid tip, T9, T10. Again, we typically don't use xiphoid to help us center for lumbar spine, but it is helpful to identify mid-sagittal plane. Okay, if you have any questions about the lumbar spine, the sacrum, or the coccyx, please let me know. Thank you.